What do you think about the state of mental health in 2017?
I think care is extremely and completely deteriorated. Many health programs now will give you, for instance, 20 psychiatric visits per year. Um, there is no, outpatient clinics are overcrowded. Um, People receive vouchers to come to those clinics. There's a constantly changing staff. People are given medications, but they don't take them. Uh, One reason that became very obvious in my earlier days is when people have problems, they will take a medication, but the minute they feel better, they think, okay, I don't need it anymore, and they stop taking it. Um, Everything is okay now. Everybody is treated as though they are totally responsible for their own selves. However, patients with severe mental illnesses become our responsibility. They are not responsible for their behavior. And now, as we see the murder rates, and as we see the attacks, as we see young people with extreme aggression, those are things that could have been treated in earlier years. We say now everything is voluntary, but it is problematic for people to actually realize when they need help. Um, when they need help, when they go to prison, then all of a sudden we realize that they have mental problems. I think it is our responsibility to address that much earlier.
What do you think an ideal system would look like?
That's a very good question. I think sometime, somewhere in the middle of where we are right now. I don't believe in enforcement of hospitalization. I don't believe in the way we are doing right now when we put people on a hold and we give them medications and all of a sudden we say, oh, now they're cured. Uh, they're taking the medications while they're on the hold, and the minute they go out, they stop taking their medications. We now have very long-acting psychotropic medications, which would be very helpful in many of those cases. But when your decision-making capacity is disturbed, how can you decide when you are well and when you're not well, particularly when it comes to mental illness?
Do you think doctors should be given more power?
I think psychiatric treatment needs to be more cohesive. Private psychiatrists simply are not prepared to take care of chronically ill patients. If you have like an appointment every third Wednesday at 11 o'clock, does the psychiatrist really get the full picture of what this person is suffering from? No, they're not. When these people are in a more home-like environment where the staff can assist in telling the psychiatrist what their general behavior is 24 hours a day, you can get a much better picture. So it is not really the fault of these outpatient psychiatrists. I think it is the fault of our current system.
What country do you think has a good system for dealing with this problem?
From what I've seen in other countries where I have traveled, um, I think psychiatry is such a broad spectrum problem that if you have more discipline, if you have more parental involvement, if you have more appropriate activities for children, if you have more parents that are more interested in the care of their children, all of those issues combined would be helpful to raising a mentally healthier population than what we have in the United States.
Do you think that people are on too many drugs, legal drugs?
I think yes. I think a lot of people think there's a pill for everything. And I think this, particularly in the United States, if you have any problems, you go to your doctor and you get a pill. And I've met in my career many elderly people that come with just bottle after bottle of medications, and they have no idea what the medications are actually for. You add psychotropic medications for that, and nobody really seems to know the interactions and how things are working.
What do you think about the current use of Prozac?
I think Prozac was started as a feel-good medication. We have many other medications that are supposed to be anti-anxiolytic and anti-anxiety, but usually if you address the cause, you can really deal with it better than to just medicate it.
Thank you very much.